Hi friends, good evening. Myself, Dr. Baisali Sarkar. I'm a consultant ENT surgeon practicing in Kolkata. I've come over here to give you a knowledge about acute otitis media. Why I want to discuss it? Because it's a very common topic and it occurs in a lot of patients, and diagnosing it and coming to a doctor or treating it yourself, how to do it, how you can prevent it is mandatory and important to know. Okay, so what is acute otitis media? Basically, if you are facing recent cough cold symptom, I'm getting a lot of patient of cough cold symptom. Okay, now after a few days or few weeks, the patient is complaining of ear pain. Okay, or even at the same time the patient is complaining that the patient is having some ear pain. Okay, it can be one ear, it can be both ear. Okay, it can be accompanied with nose block, or it may be running nose, or maybe cough cold fever, or it can be the patient can give a history of cough cold in the recent time. Okay, so when a patient is coming with the symptom of pain in the ear, blocked feeling, reduced hearing, okay, or a sudden pain in a ear, then we deduce it to be a possibility of acute otitis media. Okay, so in general, the patient say that my ear has got blocked. I try to take it out by using any earbud, okay, and but nothing is coming out. Okay, so most first important point is do not use any earbud. Okay, why? Because if you use earbud, it may rupture the eardrum. You never know what is there, any wax is there inside, or any foreign body, anything, whether anything is there or not, that may harm the eardrum. Okay, second important thing is do not do Valsalva maneuver. What is Valsalva maneuver? It is a like exercise where you pull in the air from the mouth and the nose, okay, and try to drag the air by closing the mouth and the nose to the ear. Okay, in that process, what happens? Air pressure generates inside the ear, and there is a temporary sensation that the blocked ear got open. Okay, but when you are having acute otitis media, it is detrimental. Why? Because this is middle ear inside. Okay, but the back portion, this is the back portion, it's called mastoid. So secretion tends to pass more deep inside the mastoid as well as more deep in the middle ear, and the secretion, more possibility of coming out from the nose or the throat becomes less. Okay, second thing is when you are facing like cough cold problem, you have to treat the cough cold, not only the ear problem. Okay, treating the cough cold may be antibiotic, antihistaminic, okay, and the most important medicine is a decongestant nasal drop, okay, to decongest the ear. Right now, when you are facing these symptoms, what can be the possible cause of it? Obviously, the possible cause, most important, is in acute situation, either it can be viral, it can be bacterial, hence the treatment is done accordingly. Okay, so my take home message for my patient, if they face problem like this, like sudden blocked ear, sudden pain in the ear, okay, and associated with cough cold or a history of cough cold in the recent time, like a week or so or a 2 week or so, okay, and there are certain patient who have not getting treated, just like took some over the counter medicine, got a little bit relief, and then it got aggravated. You should consult a doctor, because this acute otitis media, initial time it is treated, and then it may be harmful. The pressure which is generated in the middle ear may like rupture the eardrum. Okay, do not use earbud, do not do Valsalva maneuver. Okay, if you are having problem, preferable to use a decongestant nasal drop, and best is to consult a ENT doctor for otoscopic examination at the earliest. Thank you friends for listening. This will definitely be helpful for you in your day-to-day life.